Gianluca Campo and Mike Gibson join you live from ESC 2024, and we're talking about culprit-only versus complete revascularization in older STEMI patients. Gianluca, talk to us a little bit about what you did and what you found.
Yeah, so this is an individual patient meta-analysis, and we work with all the investigators of the EARTH-STEMI group after the result of the FIGHT trial, because last year at the ESC Congress, we presented the FIGHT trial and we showed a strong reduction in hard endpoints in older MI patient with complete revascularization. However, some important limitation should be disclosed for the FIGHT trial, because the FIGHT trial enrolled both STEMI and non-STEMI patient. The follow-up was limited to 1 year. So the research question is, the benefit that we see in the FIGHT trial was consistent also in the other trial. It was consistent at a follow-up longer than 1 year. So this is the research question of the EARTH-STEMI analysis.
So how many patients and what did you find?
Yeah, we did a search strategy identifying 7 randomized clinical trials. The biggest was the complete. We have also data from the full revasc, PRAMI, compare acute. So 7 randomized clinical trials, and overall we collected information, individual data from 1,733 patients, randomized to complete or culprit-only revascularization, with a median follow-up around 2.5 years, so longer than 1 year. We have a lot of patients with a follow-up of 3 years. After the 3rd year, the number of patients with a longer follow-up decrease, and this is a limitation of our analysis.
And you say these are older STEMI patients, you know, the older I get, the older older gets. What's older?
Yeah, 75 years old. So we recruited from the original database of each trial only the patient admitted for STEMI, so ST segment elevation MI, and 75 years old or older.
And the revasc could have been done in the hospital or later?
Yeah.
Okay.
Some trial based on the original protocol performed the complete revascularization in the index hospitalization is the majority of the patient, more than 80%. And we have some patients from the complete trial completing the revasc in the 1st month.
And what did you find?
Well, we found regarding the primary endpoint of the analysis was death, MI, and ischemia-driven revascularization. And we found a strong reduction of the primary endpoint associated with complete revascularization until the 4th year. So we have a strong reduction until the 4th year. After, so beyond the 4th year, we have an increase of adverse event in the complete arm, but please note that the number of patients after the 4th year is very limited. So at the longest available follow-up, the difference is no more significant. So we have a strong and consistent benefit in terms of MI, ischemia-driven revascularization until the 4th year, with a signal related to non-cardiovascular event and non-cardiovascular event after the 4th year.
And when you get rid of revasc and look at death and MI, was there any difference there?
Yeah, regarding this is a very important point, because the primary endpoint was all-cause death, MI, and ischemia-driven revascularization. On the contrary, the key secondary endpoint, cardiovascular death or MI, show a different trend, because at the longest available follow-up, consistent at each year, we observe a reduction associated with complete revascularization. So our interpretation is, if a patient is comorbid, sicker, if the patient is randomized to culprit-only, in the 1st year, he show cardiac event and cardiovascular death. On the contrary, we are talking about older patient. If the patient is randomized to complete revascularization, in the 1st year, the patient don't show cardiac event, don't die, but obviously in a very long and lot follow-up, we have other disease, other comorbidity, and so we have an additional rate of non-cardiovascular death.
Interesting. All right. Well, adds importantly to what we know. Thanks for sharing with us today, and thanks to all of you for joining us here live from ESC 2024.
Thank you. Thank you so much.